Does vitamin D slow aging? There's been a very interesting study that was released. It was a study out of Harvard, part of the VITAL trial, and they looked at the effects of vitamin D on aging. So this is very important because all sorts of claims are made for the aging process, certain diets, different nutrients, but this one actually did look at the effects of aging. And I'm going to talk to you more about that in a minute. But first, have you had your vitamin D levels tested? So many patients I see for the first time have never had their vitamin D levels tested, and this greatly increases their risk of disease. We know that people who have low levels of vitamin D lose bone mass, muscle mass. They're at high risk for cardiovascular problems. They're at higher risk for cognitive problems, including a higher risk of dementia and Alzheimer's disease. We know that people are going to have more problems with their immune system, whether it's an increased susceptibility to infection or autoimmune conditions. Skin health. There's so many things related to vitamin D deficiency. It's critical that you get your vitamin D level tested once a year and make sure you're at least mid-range. So we see all the time with patients, almost every day, people who have low vitamin D levels or just overtly deficient. And it's so easy to correct through supplementation and getting some natural sunlight. But let's get back to this study. This study was kind of a continuation of a large study called the vitamin D and omega-3 trial, also known as VITAL. And so in the original study, they had thousands of adults taking either vitamin D3, 2,000 units a day, omega-3 fatty acids, 1 gram a day, both supplements or a placebo. So you had the 4 different groups. And so the past results from this VITAL study showed some impressive outcomes. A 17% reduction in advanced cancers and a 22% drop in autoimmune diseases for those who are taking the vitamin D by itself. But in the latest study, they were looking at the effects on aging. And so what they did in this study is they looked at the telomeres. You've probably heard the word telomeres, and these are like the little plastic caps on shoelaces at the end of the genes, the chromosomes, so to speak. And so they're looking to see if these caps are shortening, and that's associated with aging, as well as the increased susceptibility to disease. And so we know that as telomeres get shorter, that we have higher risks of cancer, heart disease, and even early death. So this is the big question. Could vitamin D help protect telomeres and slow down this aging process? Well, here's what they found after 4 years of supplementation. People taking the vitamin D3 had slower telomere shortening, meaning their cells were aging more slowly. Well, those people taking the omega-3s had no effect. Now, obviously, omega-3s have very good effects on the body. And there have been previous studies showing that omega-3 fatty acids do also prevent rapid shortening of the telomeres, but not in this study. And then people taking both together, they didn't get any extra protection as opposed to vitamin D alone. So this is a really good sign that vitamin D, one of its many benefits is that it protects your telomeres. And if you protect those telomeres, then theoretically, you're not going to age as rapidly. You'll be less susceptible to disease. So make sure you get your vitamin D levels tested. If they're low or deficient, make sure you get those levels up to at least a mid-range, and your health will really benefit as a result of it.